Hello everyone. On the behalf of the organizing team, welcome to the first demo day of Coronathon.in, a hackathon to fight COVID-19 in India. So, we launched last Sunday, and so far we have 2,200 members and 40 plus ongoing projects. This hackathon is completely uh, volunteer driven. So most organizers and team didn't know each other before this Sunday. So whatever you're going to see today, including this whole hackathon and the projects, they were put together in a matter of days. So please, therefore, be kind in your analysis and judgment. Today we have 20 projects that are ready for the demo. The demo day will go from 5 p.m. to 7 p.m. Each of the projects needs your help, and we have asked them to mention their asks as they present their pitches. So if you can help them, please mention them in questions tab in the GoToWebinar panel, along with the project name. So perhaps you can know someone who can help some of the projects, or your company can provide these projects with resources or distribution that they may need. Ultimately, the aim is to have an impact and on ground help reduce suffering from COVID-19. So this is not a competition. The format is really that projects will present, and if you or someone in your network can help them, please mention that in the questions tab along with the project name. So whatever it may be, if you type out your help, your questions, your feedback in the questions tab in GoToWebinar, the organizing team will ensure that you get connected to the teams on Monday or Tuesday. Uh, I heard some echo. Yeah. So sure. So like I was saying, if the aim is that today it will be one to many sort of a pitch. If you can help the teams type out in questions along with the project name, and the organizing team will connect you to the project teams on Monday and Tuesday. So with that, please take a moment to locate the questions tab and type something like "got it" or an acknowledgement to ensure you're able to interact with the organizers. Fantastic. So I hear that people are able to locate the questions tab, and some people said they hear an echo. If you still hear an echo, please let me know. Okay. So some housekeeping comments. Since everyone is at different places, including all the teams, and some of them also not met in person, obviously because of this lockdown, net connection is an issue. So please bear with us if you see some issues or lag as teams present. We are recording this session, and we will be sharing it later with everyone who's registered. And this event is also getting live streamed. So if you want to share the link is on the website. And I have also tweeted it, and our official handle has also tweeted it. So I'll not take more time. Just before we start, I would like to acknowledge a few attendees uh, today who were the first ones to confirm their support for the teams. So we have Alok Mittal, CEO of Indify and founding member of Indian Angel Network. We have Shiva Chinnaswamy, who's Director of Engineering at Google Pay India. We have Dr. Biju Jacob, India Director of United Nations Healthcare Innovation Exchange. We have Pranay Patil, who is with the Innovation Unit at National Health Authority. And again, we have Avinash Raghava, who's with Axel Partners. Of course, there are many, many more who's come forward. The support has been unimaginable. And the whole team is grateful for everyone who's come forward to help the teams. So with that note, I will have the teams begin. The ideas you see today came organically in a bottom-up fashion, and that's why you will see that some of the teams ended up working on similar ideas. We will be presenting similar ideas back to back in so that you can compare and contrast their differences. There are 20 projects. Each project gets 5 minutes. There is no live Q&A, but we encourage you to put questions, feedback in the question box along with the project name, and we'll connect you to the teams later. So the first category of ideas is essential services, and the team is Safe Zone. I will now pass the presenting permissions to Akshay, and he will take you with the project. Akshay, you should have the presenting permissions.
Hi,
Akshay,
can you
can you
guys see
unmute
my
yourself?
screen?
Yeah. Yes.
Okay, so in this global crisis right now of COVID-19, uh, we have big problems when it comes to buying essentials. So first thing is, whichever shop you go to, there are big queues for essential. The stores are overcrowded, which leads to low confidence in people while going and shopping that they might contract the disease. And many of the stores are closed on their usual times. So the solution that we thought, like what we could to do it, is try to evenly spread customers in different time slots, give them correct information of store timings and status, whether the store is open or not. And we also provide them with a proof of essential travel. So currently we see that police is catching people who are traveling. So this gives them a proof of essential travel that we are only going, say, once a day to buy groceries. So our solution is an app called SafeSlot, getting essentials safely during the crisis time. Our team comprises of me, Akshay, Shubham, Hardik, Sanket, and Aditya. So I'm going to present a demo in front of you. So this is our mobile app. We have hosted it on Heroku as of now. So the phase one comprises of the client side mobile app, in which uh, you can go and book your slot for groceries or for medical stores. So I'll show you a demo. Say for example, I live in Delhi. I can click on Delhi and see the nearby stores that are available in that area, or I can just go look for a particular area, say Ghaziabad, and then all the stores in that locality would come. I think internet is a little slow on my phone. So when I click on book slot, it'll show me all the slots that are available for that particular store. For example, we have listed some demo data over here. I want to book 12:30 to 1 o'clock. I'll click on book now and it'll ask me for registration. So we are thinking of providing one or two access per day for grocery stores in the entire app. So any store you want to go, you'll get one or two access for it, and with that it'll get booked and we'll get a booking ID which can be shown to the store and they'll give you access to it. So we are planning to make it for groceries and for pharmacies. For groceries, current features are number of slots based on store or counter size. We don't want to overcrowd it. For example, with a small counter we might give 3 slots for a particular 10-minute or 20-minute slot. For a big store, maybe 30. So slot time will be based on average shopping time, and it also gives a proof of essential travel. What we are planning to integrate soon is verifiable code for store entry, that the store side, on the store side app also they'll get all the details of which customers would be coming. So we'll give 2 slots per day for groceries per day. So for example, I can't book more than 2 grocery slots on the stores in the app. So that would give chance to others also to go and buy. That is required in this crisis. And store side application for live updates to slots. So slots can be updated live by the stores through their live application. And the next would be
Akshay, 1 minute
pre-order.
remaining.
Yeah, sure. And in phase three, we are planning to pre-order and drive through. For the same comes for pharmacies, and we are integrating maps next so that nearest stores can be mapped there, and also payment gateway for contactless payments. For example, it can be Google Pay or Phone Pay. So on the app only they can pay and just go and collect their essentials, medicines, or groceries. That way the stores will also be making more sales, and the customers will also be more confident about buying from that particular store. Thank you.
Uh, Thanks, Akshay. And again,
Yeah.
request to attendees, if you think you can help out SafeSlot with anything, be it distribution to different stores or funding to help develop it, please mention it in questions and we'll connect you to the team. The
One
next team,
one last thing, we have particular to ask. We need help with mass adoption. So if anyone has contacts in retail chains or can help us with the adoption part of it, then please do contact us. Yeah.
okay, great. So the next team is hospital availability tracker, and Ankit Jain will be presenting it. Ankit, I will make you a presenter. Ankit, you're a presenter.
Sure, Paras. Just presenting. Just give me a second. Guys, let me know once you start seeing this screen. Paras, you can see it, right?
Yes.
Great. Thank you. So yeah, thank you first of all for creating the Coronathon. I think it's much needed for this situation where we are in. Quickly, myself, Ankit, I, along with four of my other team members, have built this app, which will help patients to easily find out which would be the nearest available hospital for them in case the coronavirus spreads into stage 3 and ahead. There would be chances that the facilities would be very hard to find, which have space left with them. We saw that same problem in Wuhan and Italy, where the patients lost precious time and identifying which is the right facility to go. Also, our healthcare system is not evenly distributed, so there is a higher pressure where the population density is higher, and there's no unified tool as of now which can tell us where the nearest hospitals are and where they have the availability. Also, when we started this project, right, we thought that we'll get the government data for the number of beds and isolation wards which have been set up across the country. But yes, we couldn't find any information, and that also resulted into pivoting the solution a bit so that we can still solve this problem through community-based data. So what we want to achieve is a single application which can be used on any sort of device, which can easily help the field medics to find the right hospital and update patient data, for hospital administrators to update the bed availability so that they can tell people that yes, there is services which are available, and also to receive advance information for incoming patients, for police and other authorities to identify genuine cases where they might actually need help, because we know that during COVID, all the secondary surgeries and illnesses have been kept aside, and maybe the preference has to give in to COVID-19 patients. And for the patients is to also find not only the hospitals which are generally there, but also to find any makeshift hospitals or isolation wards. As we heard, that trains have been converted into isolations and treatable places, and a means to reach that hospital. So quickly jumping on to the demo, this is how it looks like. I just refreshed it. So what it does is it automatically picks your current location and tries to map all the open hospitals which are around you. As you can see, there are different icons on the screen. And if you click any one of these icons, what it will do is it will actually fetch the information and give you the data that, okay, this is the hospital, there's this phone number here, and this is the address. And these two icons which you see here is for the field medics or the hospital administration, and only will be visible to them or to any community volunteer who is nearby that hospital. So it could be a hospital staff or anybody else. But for general public, let's say if I was here at this location, I would not see these icons because I'm not near the hospital, so I should not be able to update them. Now, as soon as somebody clicks on any of these icons, so one says that yes, there is available space, one tells there is no available space, and as soon as I click that, it turns green, which is just signifying that yes, there is availability. And now anybody else, if he looks at this, he'll see it as green. Another piece of information is that, let's say if we haven't ever got any information about this hospital earlier, it will just show as a light shade of yellow for now, so as to differentiate between information which we have versus we don't have. Now, this is a very
Ankit,
quick demo.
just 1 minute remaining.
Sure, Paras. Thank you. Yes, what we are seeking help for is from the perspective of data. Volunteers, be it medical professionals, be it government organizations or hospitals themselves, so that they can feed in this information to help people. From the tech side, we need help from Google's map team, because we feel this can very well go inside the maps itself. Developers and UX and UI enthusiasts. And for the distribution, it would be generally the local authorities, government authorities, PR, media, whoever can spread this word. So yeah, that was a very quick demo of what we have done. And just a quick point, we also got tracking from Gurgaon DGHS. So they want us to upload their data, which they have collected, into the application so that people can easily find that. And yes, that is the link. And the team comprises of myself, Prerna, Pranesh, and Gaurav. So yeah, and Anshul also helped us in some bits of it. But yeah, that's the team which has worked on it. And thank you.
Yeah, Ankit. Yeah, thank you. I'll just take 1 second to take one of the questions. So Alok Mittal asked, is there a way to get occupancy data updated without each hospital having to adopt this?
So what we are trying to do is through community fed data itself. So instead of just having a full versus empty option, we plan to have many more things here, which can be then fed in by those volunteers. The only reason is we haven't opened it for everybody, because there is chances that somebody might just play and put some wrong information. So we have geofenced it to a small location, and we plan to add much more data points to it. I hope that answers the
Thank you.
question.
Sure. And everyone, please keep, again, we can read all the questions that are coming in the questions tab. If we have time remaining at the end of the webinar, we will take all the questions. And if not, someone suggested that we can make a Google Drive with team contact names. We will do that as well and send them. But at the end, like I said, we will make sure all the questions and comments are connected to people who are presenting it. So the next is Vaibhav, who will be presenting his project called PanMan. Vaibhav, I'm making you a presenter. Vaibhav, over to you.
Yeah, thanks, Paras. Hi, let me know when you can see my screen, please.
Yes, we can see it.
Okay, let me share. Okay. Hi, everyone. My name is Vaibhav. I'm a health tech entrepreneur, and I'm the founder of Hippo.ai. As part of this hackathon, what we've built is we've built a pandemic management solution, which we're calling PanMan. And what we're essentially trying to do is give hospitals the ability to manage the COVID-19 pandemic through their hospital. So hospitals today are going to be constrained by 4 resources. One is they need to ensure better patient outcomes. They need to track their availability supply of beds. They need to be able to track the number of ventilators they have, and they also need to track the amount of PPE, so personal protection equipment they have. What we're trying to do is our first product aims at solving that. So without me talking more, let me directly get into the demo then. So let me look at a simple user flow. So in this case, what we've developed is an app that can be run on iOS and Android. It's already ready. Let's assume a patient called Vijay Reddy, who's 65 years of age, comes to a hospital and he comes with certain symptoms. So using a quick 10-second onboarding flow, the nurse in charge of the receptionist adds the patient to the list. And as you can see here, once they're added to the list, there is a quick way where the patient can be sent to the screening section. And once they're in screening, their sample is taken and sent to the lab. And when it takes around 24 hours for the sample to come, and during the time, the patient is moved to the suspected isolation ward. And once the sample comes back in, unfortunately, if it is COVID positive, then the user can be quickly moved to the confirmed isolation ward. Plus, we have also tracking the COVID-19 specific health status that can be assigned to a particular patient. So COVID-19 has multiple presentations, right, from asymptomatic all the way to ARDS and septic shock, etc. So we are allowing for an easy way for the hospital to track this. So let's assume this since it's 65, let's assume he already has hypertension and he is symptomatic with comorbidity. We are changing that state, and as you can see, it's updated system-wide, and anyone who accesses this patient will be able to see it. Now, let's assume that his condition worsens, he'll have to be moved to the ICU, and the user's health status also has to be updated to a much more severe case, let's say S5 in this case. As you can see, we did all of that in less than 10 seconds, and that's how quick this is. The other workflow is for tracking equipments. So let's assume Mr. Vijay Reddy, who is in the ICU, needs a ventilator now. So in this case, the nurse or the hospital or doctor opens up the patient's page and looks at equipment, and they can see that there are 13 ventilators in the system. They quickly assign a ventilator, and as you can see, the ventilator was assigned to this patient and the overall count went down. And we also allow the nurse or the staff in charge to track the amount of personal protection equipment that's available today. So in this case, let's assume that at the beginning of the shift, there was 30 left, they updated 30, and boom, this is updated everywhere. Now, how is all of this useful? This really is useful when the hospital administrator logs into the dashboard, and using a single pane of glass, they can get a complete view of what's going on in their hospital. They can understand that this is how the patients are flowing. They can understand which departments are where the demand is more than the supply. They can look at a single snapshot of all the PPE equipment. They can know when it's going to run out. And they can also see COVID-specific health details of its COVID-19 patients. This really becomes powerful when we are talking about an ecosystem. When we have multiple hospitals and the government using PanMan, we can have a system where the statistics flow upwards, the actions from the government flow downwards, and it also allows for inter-hospital transfer. It also allows for transfer of patients, critical patients from government hospitals to tier 2 or tier 3 private hospitals. So when we're looking at the roadmap, some things that really excite us, some things that we want to build are localized outbreak predictions. Today's predictions are all macro level, countrywide or citywide. Yeah. What we're trying to do is give a hospital the insight saying how many patients will come tomorrow. And along with that, we are also opening up PanMan as a platform. Anyone can use our data and build applications on top of it. So this is our team. We have a bunch of really awesome people, along with a bunch of medical advisors from AIMS and from People Tree Hospitals here. The asks is again is to allow us to scale this up, and for scaling it up, we will need funding. We need to set up a team of FTEs. And if there are any contacts in the government of Karnataka or any other state governments, I would need their help to get this implemented there and start trials and adoption by private chains as well. So with that said, we would love to talk more. Again, this is a prototype that we built in a week. We are going to expand this, and we need your help to do it. For any details, please visit panman.in.
Thank you.
Yeah.
I have one question that came up repeatedly.
Sure.
Biju, Jacob, and I think Kshitij Jain asked, will this integrate into hospital information system, or does it have to be entered manually, the data?
If the hospital has a hospital information system, yes, it can be integrated, but the number of hospitals that have it in India are pretty low. So we have designed it as a standalone system.
Okay. Thank you. I will connect you to people who've asked this. Maybe they have more context which can be helped.
Awesome. Thank you so much.
Thanks, Vaibhav. The next is COVID-19 PPE tracker by Bhavya. Bhavya, let me make you a presenter, and I will unmute your audio connection as well. Yeah, I think you're all set, Bhavya.
Hello, am I audible?
Yes, we can hear you. Yes.
Did you make Jenny unmute?
Yes.
Okay. So is this screen shared?
Yes, we can see your screen.
Okay. Very good evening to everyone. I'm Bhavya, and my team has worked on this project COVID-19 PPE tracker in order to have the information regarding the availability and the requirement of the personal protective equipments that are required for the healthcare workers. This is my team. All of us has worked on this project. And the motive behind this one, we were shocked when we saw the news that what we are doing every day, the social distancing, only that one can't flatten the curve that we are trying to do every day, that is the number of cases. This is not possible if the PP shortage continues because the doctors and the nurses are getting sick. Regarding the news, yes, the world hospitals are running out of the gloves And Chinese people have said that 1,700 frontline medics have got infected with coronavirus because of the PPE that are not available. And we can see here the pictures where plastic bags are used by the nurses and the doctors in order to treat the patients. Coming to India's situation, recently we have seen everyone cheering for the Indian doctors. But the AIMS, the best medical college in India, the doctors there gave a statement that they don't want labs, they want the personal protective gear. And if the best college in India is stating in this way, think about the situation of other states, how it's going to save our country. The Punjab doctor is using the HIV gear equipment, which is not going to save him for COVID treatment. And also the nurses are not even having the basic facilities. We can see that the Government Medical College of Amritsar said that they are not having masks and gloves and working in this situation is very difficult. And we can see WHO director saying the number, giving the number of medical masks and the gloves and the goggles that are required in order to respond to this outbreak. And in India, we have the doctors to patients ratio as 1:1445 when WHO requirement is 1:1000. So we can see already there are less number of doctors, and with this situation, if the doctors are going to get sick, it's going to really be a worse situation for India. What can be done? The healthcare workers are running out of masks. People, they are asking people to donate. Yes, we can donate, but who are going to be the donors? What can we do? What we have done, our team, we are from IT Bombay. We approached all our professors and asked them if we can get the gloves and masks, because we know that there are chemistry labs, chemical labs, and some labs where these protective equipments are there. And since the college is in lockdown mode, no one is going to use them. So we approached them, and for our surprise, they were ready to give us the food. Here is one of the messages that we got from our professor, and we actually collected more than 2,500 gloves and 400 masks. And when we approached some other professors in other colleges, they actually asked if there is really requirement in any of the hospitals nearby. One of the professors in IT Hyderabad has already gave us a positive response, but they are waiting for an official proof for the requirement in Hyderabad hospitals. Then we came to know that there are people who are ready to donate and there are people who are in requirement, but they are not having a common platform. That's why we came up with this idea, COVID-19 PPE tracker, where we have the requirement and the availability. And if the requirement and availability are within 10 kilometers of distance, there will be a notification that there is a match. How it's working? I'll show you a short demo. This is the map that we are working on. So here you can see that there are red color and gray color marks. The red one shows that there are requirement of a 200 masks. These are some information that we have added for the demo purpose. We haven't launched our website yet. And if there is any requirement or availability, they can go press this button and then write the PP, that is, they can select the PP and then they can give the name. For example, I can give the name and the quantity. Yeah. Okay. So if they give the okay, thank you. If they give the details and then submit, then it's going to pop up like here. They can give the details of the location also. Regarding the information, they can click on this one and then check the availability and the requirements. For demo purpose, we have added all these details. So in this way, the people are able to know the requirement and the availability. And if both of them are near to the same place, then there will be a notification. And when the person clicks on the notification, it directly goes to the map where it is available. So that's a quick demo. So this is how we are working on this one. And yes, we need help. We want the website to be launched. We are planning to launch it in 1 or 2 days. So we need some help and we need some infrastructure support as stated over here. Also, the assistance from the Google Maps will be helpful for us in order to introduce more features and logistic support in order to transport, because right now we are only informing and giving the information to others. But if there is logistic support, then the collection and transport also can be taken, and we need some volunteers from all over the country who can help us in contacting colleges and also industries who can donate PPE to the hospitals facing shortage. So that's a quick PPT about my project, our project. So
Great.
if you have any question,
Thanks, Bhavya. We are out of time, but a lot of people in the comments either have questions or offer to help. The organizing team will connect you to those people Sorry, 5 minutes is over. I would have taken one question, but I will go to the next one for now. So the next one is Corona Daily Updates. It's by Sandeep. Sandeep, I will make you a presenter. Sandeep, you should be able to present now. Sandeep, can you unmute yourself? We can see your screen, but we can't hear you.
Yeah. Can you
Yeah,
see
we can hear you now.
Can you see the full screen now?
Yes.
Okay.
Yes.
Hi. Thank you everyone for coming to this webinar. My name is Sandeep Gangarapu, and I am the team lead for this project, Corona Daily Updates. First, I want to acknowledge my incredible teammates. So we just came together 2 days ago, and we worked really hard on this to produce something what we believe is an impactful product. So every morning when I wake up, so the first thing I do is open my phone and look at Facebook and WhatsApp. But for the past 2 weeks, so that's not what I've been doing. So first thing I look at is what are the new coronavirus cases in India, in US where I live, and overall in the world. So I look at if they're increasing or if they're decreasing, what is the trend, all these metrics. So in order to make sure how I should respond to this. So it is not just me. Even my father, who calls me every day in the morning to ask me if I had breakfast, so he stopped asking that question now. The first thing he asks right now is how many cases of coronavirus in India? How many are there in Andhra Pradesh, where he lives? So what I do is I go to this really beautiful dashboard maintained by Johns Hopkins COVID-19 dashboard. So they have good visualizations, every data that you can imagine about every metric that you can imagine. And also there is this website called COVID-19 India, so where there are beautiful graphics related to India and good breakdowns as well. So I am covered. So if I want information, I can go to these dashboards. So, but not everyone has this privilege. So there is a huge underserved demographic who don't know like these dashboards exist, or they can access and understand these dashboards. So especially these people are older and rural community leaning, and they have limited technical ability. So the only way they get their news or they get their numbers, so it's from TV, and generally like TV reports, so they give very high level information. So this is a problem. So this is a problem hugely because this is the same demographic, so that is prone to misinformation. So they tend to believe like WhatsApp forwards and like whatever the word of mouth anecdotes. And if they don't get correct information, don't get like how serious this global pandemic is, so they tend to make bad decisions and keep themselves and their entire community in danger. So we wanted to solve this. We wanted to give access to data to everyone. So the solution that we thought of is, go where the user is. So, and where is the user? So the user is on the mobile. So we've seen the data released by Facebook that over 400 million Indians are using WhatsApp. And so we plan to use this medium to send accurate information directly to them, directly on WhatsApp. So we created a website, which is very simple, so very clean UI, very intuitive. So all you need to do is, so once they get hold of the link, they click on this and it will open in the browser. And they need to enter their PIN code and phone number and then subscribe. So it's just like a 1-minute workflow, and everyone generally know their PIN code and phone number. So it works everywhere. So there is no problem regarding that. And so what we would do is we would send one message every day about the cases. So based on the PIN code, we would know the district, state. So based on that, we would send the cases in the state, cases in overall India. And if we have data for the districts, we'll send that as well. So they can get this information and know like what's happening around them, and that will make them take an informed decision. So right now, so we are planning to roll this just in one language, but in the next 2-3 days, so using the amazing volunteer force that we have at coronathon.in, so we are planning to translate this into all vernacular languages so that it is even more easy for them to subscribe. So there are actually other solutions out there.
1 minute ago.
Yes. So there are other solutions out there. So Prime Minister Modi, like yesterday, he released a chatbot on WhatsApp and also a chatbot on Facebook Messenger. So, but again, if you look here, the information is very high level, and this is again a bot. So you need to ask for information, so it won't give you automatically. So, and we don't believe that. So the demographics that we are targeting are, like especially excited about this. So yeah, so the roadmap is we are planning to release this out tomorrow, and subsequently use this as a, like if we get enough traction, use this as a platform for other messaging services as well. So we feel that this is an impactful product, and this is a very practical product as well. So if you believe the same, so we need your help in some of the areas. So the first thing is we still have some problems with WhatsApp in order to get the API access. So if you have some contacts, if you can speed up this entire process, we'd really appreciate it. And also, like if your organization already does something similar, like where you have a group of audience that you are messaging. So if you want to partner with us, so we can send messages through your um, data streams as well. So we can do that. And also, if you have other
Thanks,
communication channels, yeah. So yeah, so that is it for me. Thank you.
Thanks, Sandeep. We did get a couple of questions and
Okay.
suggestions to help. We will
Mhm.
connect you to them. Some people are saying that they can help you distribute this widely.
Okay, sounds good. Yeah.
So great. Yeah, thanks, Sandeep. The next is Corona Stats bot by Chandan. Chandan, I will unmute you. Uh, just give me a second. Yeah, so Ankit, you will be presenting Chandan's.
Yes, Pabs.
Let me make you a presenter. I'm trying to find Chandan in attendees. Can someone organizer unmute Chandan? It's not sorted by names. Yeah, it's sorted now. Just I'll unmute him. Yeah, Chandan, I got it. Chandan, you should be able to speak now.
Yeah, thanks, Paras, and thanks, Ankit. Good evening, everyone. I'll be presenting Stats. It's a bot that is a Slack-based bot, but it can be used in MetaMask as well. We chose Slack, and currently it's available on MetaMask. And for Teams, Microsoft Teams, and Discord, we are still working. In in Slack, Slack has 20 more than 20 million daily active users, so that exposes a wide range of users. So we thought of making the passive information actively available in the chat window itself, because more and more people are working from home. So they anyone can run this command and get the stats instantly, and that is instantly available to all the users that are in that particular channel. So we can move along and see how easy it's to set this up. So you can go to the apps section in any workspace, any Slack workspace, and search for Nimbella. It will pop up the Nimbella commander. You can click on it and it will get installed. And once it's installed, then you have to run these two commands. That is CSM install Corona Stats, that will install the board. And by default, it whoever installs the command will be in control of running the command. But you can allow other users to use it using this the second command, that is command runners Corona Stats, and anyone. So once this is run, anyone can run that command. And this that was the simple step to set uh, set that up. And we can now run this command using this command format and see Corona Stats. It can accept country name or two-letter abbreviation of the country, and R stands for region. R is optional. It can be given, you can specify the state name or two-letter abbreviation of the state, and even you can specify the district name. So here are a few examples that uh, the ways this command can run. Yeah, this This specifying the H dash H will show the help as to how to run the command and what are the options available. So here we are seeing the stats for India, total cases, total fatalities, new fatalities, critical cases, recoveries, and total number of active cases. We can also specify the state name. So here IN stands for India and R for region, and then we are specifying UP. So it's showing the stats for Uttar Pradesh. And similarly, we can specify a district name, and it shows the number of confirmed cases in that particular district. The command can be scheduled using these simple commands, so that you can schedule it to run at particular intervals or at certain time. And you can simply have a comparative study or comparative analysis spanning over the days. You can scroll up and stats will there be in your chat window. You can see how the stats were yesterday or the day before yesterday. That information is not particularly available on the websites, because you only have stats for 2 days in Worldometer. And but here you'll once you schedule it, you'll get the stats,
Chandan,
and
1 minute
that will be
left.
there in. Sure, thank you. So there are few extensible points that we are thinking of. So we can we can include some more information, like we can include a stepwise flow to differentiate the pandemic from a normal flu, because there's a lot of confusion. Uh, we can integrate some user interactivity and so the like uh, differentiation factors, and we can also show the hospitals, beds, and helpline numbers information or test centers information for a region. Yeah, thanks. And this source code is open source, so it's available given on the link. So it can be tweaked to include more information. And the
Thanks, Chandan.
information we are,
Thanks.
yeah, thanks,
Yeah,
thanks.
Chandan. Thanks over. Thank you. Um, I do. I mean, we all on Coronathon Slack channel are addicted to this. So if your team is working on Slack, do make use of it. People can find out the Slack Corona stats right in the Slack. We've been using it all the time. So the next is stay at home. No, next is Corona Go, and I'll have Arbob present next. Chandan, I will mute you. And Arbob, you should have the presentation rights.
Yes. Thank you.
Yeah, we can see your screen.
Yeah. So, hello everyone. Myself are Bob. I'm the project lead here at CoronaGo, and I'm also co-founder at a blockchain gaming company where we gamify regular consumer apps and games. So that's where this idea came from. So the COVID-19 is one of the biggest threat to humanity of in 21st century. Like the whole world, countries are going into lockdown mode. Measures are being taken. So we have seen that it's the most proven way to prevent the spread of COVID-19 is social distancing, according to WHO as well. So why social distancing? You can see that in a normal scenario, one person infects 406 people, and after 15 days, 16,000, and after 2 months, 100,000, which what happened in the US recently. But after 75% leftover contact, we can reduce it to one person infects only 2.5 people in 30 days and 100 people in after 2 months. So that's how effective social distancing is. Here you can see a graph of many countries implementing forced lockdowns, and on the left side many countries implementing no, not implementing the lockdowns, so they paid the price and the cases short up quite like significantly. So the thing is, the humans are social animals. Our basic human instinct is to stay close to the people. So what to do now? So how about, we thought that how about gamify the whole social distancing thing? How about rewarding the people to stay at their home and away from other people? How about making them compete with global users on who stays at their home the longest? So it's amazing, isn't it? So let's see the demo. So here's our app. The prototype is almost done. Where user can register first. They can create an account. They can enter their number. After the OTP verification is done, they can enter their details, and after that they will have to set some permissions due to off locations. So how this location thing is works is we are using geofencing tech, which basically tracks the user's home location. Here users can mark their home location and tracks if user is inside that home location or not. If user is inside that location, then they will get rewards. If not, then they will get penalized. So here is the home screen where they can see how much social distancing they have done, all the confirmed cases, safety precautions, latest news, etc. The wallet here, they will earn some coins after social distancing, and which they will later redeem it into different coupons. So every time they do social distancing, they will earn some coins which they can redeem it into coupons. The leaderboards here, they can track using how the milestones, how many coins they are away from next level. The leaderboards as well, their global rank and the badges here, they can later share it to social media among their friends for the virality, and they can also invite their friends as well. So that's what we are doing. Coronago basically rewards users to engage in social distancing, and which they can later redeem it into coupons. The current traction is basically we have prototype launched. The global launch is planned for March end. We have 300 plus waitlist signups, 1000 plus traffic, and we have also partnership with many influencers and reward coupon providers for the launch. We have amazing team of 20 plus open source collaborators, 100% remote. The target market is basically 1.26 billion if we count 90% of the population affected by it using our app. So the growth plan is basically the influencer endorsements and the inherent virality due to the environment we have right now. The social media sharing which is built into the app, the global launch plan for product and hacker news as well. The future roadmap is basically proximity-based social distancing, where users can see if they have came in contact with other infected users or not. The like rewarding good habits like washing hands and timely self-isolation. Determining efficient routes after the lockdown ends to get to other location like offices, etc. Users can also chat with nearby quarantined users
About 1 minute
using our map.
left.
Yeah, thank you. And also the projected impact we have is if one person infects 400 people in 1 month, then after if 100k daily active users, we can save 40 million lives from getting infected. After 1 million daily active users, 405 million, and after 5 million, the infection transmission is basically 10 to 0. So that's our plan. The things we need your help with is basically funds regarding the hiring full-time members and operation and marketing costs, software tools, server credits, which is basically the most significant part of it. Our partners contact Shiva sir from Google Pay. He can help us with that. And the shout out from the social media from our audience. Our website is this. So it couldn't have been possible about our amazing team. Like we have a great team members from Microsoft, GitHub, and many other great companies who are tirelessly working on that. And all of these are volunteer. They don't have any incentive here with that, except they all like this idea a lot, and also the supportive organizers. So here is the last quote from MIT: "Social distancing is here to stay and will change the world in many ways." Thank you.
Bob, thank you. There is one question that came up again, so I'll just ask that question. Uh, some people have asked, how do you ensure if someone leaves the phone at home and then
Yeah, that's the
they,
first question anybody. Yeah, so we are using basically an accelerometer which basically detects if phone is inside their hands or not. So if they are sitting idle in any table or that, the accelerometer will detects that, and then the timeout. There is a timeout limit of 30 minutes. After 30 minutes, the timer stops, and the rewards will also become stopped. So the accelerometer and the GPS location checks if the phone is idle or not. So they
okay,
have to
okay,
keep using that phone.
okay. That makes sense. Thanks. I will move on to the next presenter. It's Sayam Jain from the project Stay at Home. Sayam, I'm making you a presenter. Same, you can unmute yourselves and share your screen to get started. Sayim, can you unmute yourself?
Hello?
Yeah, Sayim, yes, we can hear you
Yeah,
now.
can you see my screen?
Your screen.
Yeah, thank you so
Yes.
much, Faraz. Good evening, everyone. My name is Sayam Jain, and I, along with Ankit Jain, Abhishek Batra, is working on a project named Stay at Home. So, what problem we are going to solve in this is you have been listening to the term social distancing these days quite a long. So, basically, social distancing is not the absolute measure. As the virus can stay on surface for very long, so it is highly contagious. So, what we are promoting is self isolation. So, we have created an app which allows the user to self isolate himself from the society. Also, there are many families who are apart from each other, like many children are not with their family. It helps family members and relatives to keep a track of their loved ones. So the problem we solved by it will create a virtual Lakshman Rekha. For that, we have used geofencing. So currently, we are providing two features: self alerting, which is basically alert the user as soon the user leaves the geofence, basically the Lakshman Rekha, and the sharing alert. Alert the family members as soon as their loved ones leave the Lakshman Rekha. So I'm just gonna go with the demo here. Yeah. So basically, this is an Android app. You can select your range, you can select your Lakshman Rekha, and you can just start monitoring. I've set my Lakshman Rekha, and the monitoring is started. Uh, so as soon the user moves, and as soon the user exits the Lakshman Rekha, there is a pop-up, there is a notification for self-alert, along with there are some vibrations in your phone. So it's to notify you that you have reached a danger area. You should not leave this area. Also, there is a sharing button uh, which you can share with your family. So once someone in your family or relatives or friends accept this invitation, they will be notified whenever you leave this Lakshman Rekha. So yeah, that's the demo. And what our USPs are, we are completely safe. We are respecting the user's privacy. We are not saving or sharing any user's data. Also, there is a social pressure on everyone to stay at home as their friends will get alert. And also, we are deciding to add some multiplayer games to keep them engaged and allows the users to stay at home. And what our ask here is, it would be very helpful if we can get $2,000 worth of Google Ad credits. Also, if someone have any contact, they can get us the list of all the coronavirus patient along with the complete location. What we are trying to do is to notify a area which is a less or more prone to a user. Like in my area, I don't know whether what are the number of cases of corona in my area. Also, there are many rumors going along, like so and so person is found positive for this coronavirus. So it would be very helpful so we can show it on a map, and we can just restrict the range of Lakshman Rekha. Like if a area is more prone, the range of Lakshman Rekha will be around very less, around 50 meters and all. So yeah, I guess that's it.
Sayam, there was one question that came up. Uh,
Yeah.
some Srinivasan asked, he feels this can be used for surveillance. What are your thoughts on
Mhm.
that?
Yeah,
Like,
I
can this
think
be
it can.
misused?
Uh, no, I think the people they are not showing any kind of data. So the user won't know whether the person is where or where at a time. So I don't think it could be misused.
Okay.
Yeah, hi, this is
And
Ankit. I'd like
another
to
question.
answer that as well. Paras, just give me a quick second. So
Okay.
there is no location data being saved on any of the servers. So the surveillance is only between the peers who have selected to share the alerts. So there is no location data shared anywhere.
Okay. And second question, Neeral asked, can I draw layout of my bedroom house as Lakshman Rekha?
Yeah, we are giving a
Hello?
range from the minimum range is 10 meters. Like your
Okay.
home is basically a Lakshman Rekha. You have to draw a Lakshman Rekha outside your home. So the minimum range to set a Lakshman Rekha is 10 meters. If your bedroom is quite big enough, then 10 meters, yeah, you can then set.
Okay. Okay. Cool. Thank you. I will move to the next team. So the next team is uh, 3D printing manufacturing. I'll have Payal go first and then Vishal. So Payal, I'm making you a presenter. You should have presentation
Yes,
access now.
yes. Can you see my screen? Hello.
No. Yes.
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 Can I go ahead?
Yes. Please go
So
ahead.
hi, good evening, everyone. I'm Payal Doshi. I'm presenting your project called 3D Connect. Our team members are Payal, that is me. I work at Imaginarium. Next, we have Vishal and Paras who work for Zoomcast, and Karim, who's an individual and owns a 3D printer. So this presentation as a project is of two parts. The first part is about the 3D printed medical devices which have come up by Imaginarium, and second part is about the 3D Connect app that Vishal will take over. To take you to the first step, which is about Imaginarium. Imaginarium is India's leading rapid manufacturing and rapid prototyping company, which is centered in Mumbai. We are capable to design, prototype, and produce parts, components, especially for medical purposes. Also, we are ISO certified, so we are able to, we are capable of 3D printing products in biocompatible nylon PHL material, which is fully usable for the doctors and safe for them. Taking you to the first product that we have come up with, which is the face shield, which is the most essential personal protective equipment. This we are working in closely collaboration with our friends at Makers Asylum and Divide by Zero. This is a low-cost face shield which protects emergency room doctors from exposure to contaminated droplets and breath during the treatment of patients. The shield we are making have minimum human contact, which can be flat packed and shipped anywhere in huge numbers and are easy to assemble. Uh, Also, the next slide, which is about the other 3D printed medical devices that we have come up with, we would like to welcome any innovators or company who's seeking in support of prototyping or production of components such as ventilator walls, splitters, surgical masks, guides, oral care devices. We would love to get in touch with them. We are also looking up for people around who have access to very minimum simple materials and tools to produce parts. Example for face shield, if they have raw materials like acrylic sheets, PG, we would love to share them our open source designs, and then we can scale up this project on a higher scale. To continue, I will love to hand over to Vishal, who will explain more about the 3D Connect app.
Vishal, I will make you a presenter.
Can we have Vishal?
Yeah. Vishal, you are a presenter.
Yeah. Are you able to hear me?
Yes.
Okay. So, hi guys. Um, so, as Payal said, the idea is to build these 3D designs in India. And what we have seen in past couple of months is countries like Italy, countries like China have built such open source designs, which we can incorporate in an app. And uh, so the 3D Connect app will help us list all the open source designs which are available uh, and which can be used to fight coronavirus. The second thing what it can do is it can act as a bridge between the hospitals which are there and the government agencies and the 3D printing manufacturer or individuals who have 3D printers. and want to manufacture that for the hospitals. The third thing which we are proposing is uh, people like Imaginarium can add new 3D printed printer products, and this can be added in the app, and hospitals can request these products uh, over the app. So yeah,
Vishal, you have a
I'll move
minute.
over to the yeah, I'll move over to the demo. So the initial landing page is a login page, and after that, once you log in, you have a list of available products which can be 3D printed. Now, let's suppose a hospital or a government agency wants face shields. They can get in and understand uh, what is the use of face shield, and all the designs are open sourced. So they can look at the designs if anyone wants to, and they can the places where they can get this fish manufactured. So one of that is Imaginarium, suppose, and they can understand how many printers they have, and the website of the company, the contact person, and get in touch with the person. So the other thing which I was talking about, this is still in building phase. So people can come and say, I want safety goggles, I want face shields, and
Vishal?
3D. Yeah, yes. So yeah, that was the demo, a quick demo, and the community ask which we have is the face shield designs which are there. We want to open source that. So we want doctors and authorities to get in and do emergency approvals for all such designs, even face shields, and we have ventilator splitters as well. And we want to mass scale up this, and we need help with and logistics
Vishal?
of this. The second phase of
Uh,
3D printing app is something which are planning.
Vishal, the time is over.
Cool.
Yeah.
Yeah.
So I have one sort of question that I'll take, and perhaps Payal, you can answer it. People have asked, how much this can be scaled at Imaginarium and across India, which means how many 3D printing bandwidth does India or Imaginarium has? And second, have you already done this or not?
Yes, so for the face shield example, we are already right now scaling up to 10,000 face shields, which we are building, which we are preparing for the three companies that I mentioned. We ourselves can 3D print more than 1,000 parts a day. We are already in collaboration with more companies throughout the India, like one from Hyderabad, Aurangabad, to manufacture as many parts we can. So we can scale up this really quickly if we are able to figure out the distribution and logistics support, and also funds to do so.
And Payal, are these approved by ICMR or other authorities?
So we are getting almost all the equipments approved by hospitals nearby us, which is Seven Hills and Kasturba, that is in Mumbai, from the deans of the hospitals. And also we are in talk with some government bodies to approve it for, as you mentioned, the approvals, which will be mostly
Okay.
done by tomorrow.
Okay, cool. So the next up is X-Ray Corona by Justin. Thanks, Payal. Thanks, Vishal. You
Thank
can
you.
mute yourself. And
Yes.
Justin, I will give you, you should be a presenter now. Justin, I've unmuted you, so you are good to go.
Okay, good evening, everyone. I am from Team Project X-Ray Corona. The I hope you all can see my screen.
Yes.
Okay, so
Justin, this is fine. You can just use this mode itself.
Okay, for starting with, why do we need an alternating testing for COVID-19? Basically, the only way to stop the spread is to test massively and quarantine. So, however, what we lack is the availability of testing kits. Why testing kits are not available are because there are manufacturing and supply chain constraints to make the testing kits available across all geographies. So as you know, the delayed testing is fueling the spread, and we want to reduce the burden on the PCR based testing facilities. Radiological imaging can serve as a alternative to the PCR based testing. Unique patterns are observed in COVID-19 in X-rays and CT imaging. China has already conducted such radiological examinations and has been successful in showing that it can identify COVID-19 by radiological imaging. Radiological imaging AI is not a new thing as of now, because it has been widely used by several developed countries to identify lung conditions. The most important benefit is that testing results are instantaneous. So I will quickly go through the product demo. So here, what I can do is I can do my name. I can take initial uh, conditions like, do I have dry cough or sneezing or breathing issues. I can take some other important indicators like what is my age group and temperature and gender, whether I have already gone through this, and then maybe I can upload the CT scan images. And you optionally can also upload some blood reports and serological reports, and then you can check on the evaluate. So basically you can see that there is this formation of mass around here, and that we can highlight by the region of interest, and we can also show around 12 lung conditions for which we have which are prevalent, and we have used a certain data set which shows whether this certain image is COVID positive or not. The dataset that we had used to train our model was the COVID dataset that is openly available. It had a total of 5,949 images, and the positive test cases was 76. The accuracies for COVID prediction was 80%, and for positive prediction, and that is an important metric. Thirdly, the architecture, some technical detail is that we used COVIDNet. It has been released by Hong Kong. Our goal is to build a COVID dataset that will improve the accuracy, relevance, and context, and that will capture the Indian context. The benefits of this is that it is 15 times cheaper than a PCR based testing, which costs 4,500, versus an X-ray imaging that costs only 300 rupees. Instantaneous, you don't have to wait for 3 days turnaround time, and we also foresee that a lot more of patients will be detected as COVID. A lot of testing samples will go through, and this turnaround time for a PCR based testing is going to increase from 3 days to perhaps 7 or 10 days. There is no need for sample collection, transport, management infrastructure that is required, and certainly this could also be used as a screening test for a confirmation of a PCR based testing. Sure. Our next steps are basically hospital adoption strategy. We want to develop a COVID patient record management system to give them a platform to coordinate with the nodal agencies. Currently, communication is done through emails. Emails are an inefficient database. We also plan to integrate with existing hospital management system through APIs. I would like to introduce a massive contribution by our team, Ankit, Maheshwar, Amritesh, Ronald, and 23 more people who have really helped in building up this project. Our ask is that radiological data, our basic need is a lot more of radiology data for COVID positive patients to enhance our data sets, and some funding to the tune of $20,000 to get full-time interns and employees to build the product. Thank you.
I have a couple of questions that have come up. I'll just aggregate them. One is around I think asymptomatic patients. So
Right.
if does it work on asymptomatic patients as well? If is it able to
So
detect?
yes, so the symptoms follow the lung condition. Basically, symptoms are a result of the lung condition and not before that. So there is a certain time before which we can. So as long as it is microscopic, we will not be able to do it. But we will certainly. There is a certain stage when the lung becomes affected, and there are still no symptoms, and that is the time when which we can be able to do it. However, a
Okay.
lot depends on collection of the and building of the data sets at the appropriate time.
Okay. And second question was, someone mentioned this is not approved by ICMR, which is the topmost agency that approves it. So do you know
Right.
anything about regulatory issues in getting this approved?
I believe this is because we do not have complete data sets. The world does not have a similar data set of identified people who have been identified COVID-19 at early stages for a detection test. Mostly the detection test has been conducted for COVID-19 patients who have been severely affected. So the data sets only capture those people who have been severely affected. So as a testing mechanism, this is not approved. How? Because they want a test which will be which will be more microscopic in nature. However, if we build a data set corresponding to that, I believe it will be approved.
Okay, thank you. Thanks, Justin. I will move to the next team, which is COVID SOS. And
Thank you.
Siddharth Jain, I will make you a presenter. Uh, Sid, Organizer, anyone is able to find Siddharth Jain? Trying to. Okay, can you sort out
Okay, can
Siddharth
you
Jain?
sort out Siddharth Jain?
So we'll move forward, and I
So
will
we'll
go to the
move
next project.
forward, and I will go to the next project.
Okay, so we'll move forward and go to the next project. It's Locked But Not Alone by Savvy. Savvy, I will unmute you and make you a presenter. Savvy,
Yeah,
it's over to you.
yeah. Uh, Good evening, guys. This is Savvy here, and I'm leading the project Locked But Not Alone, along with Gagandeep Singh as the technical head. And we also have volunteers and psychologists who are working with us on this. So,
Savvy, we're not able to hear. No.
this epidemic, this has made us like really go through really strange emotions which we have never felt before. Even our generation or our oh my god. Hello,
Yes, Savvy,
hello.
you're
Can you hear
cutting
me?
off. Yeah.
Okay, and can you hear me now? Okay, so where was I? Yeah. So this
Yeah.
epidemic, it has made us like go through really strange emotions, and our generation or our parents' generation, we have never witnessed something like this. We are locked inside our houses. There is uncertainty related to how long it can go. People are worrying about grocery supplies, fears of getting infected. In fact, people are scared to go close to their own family members, even their children, and of course mass exodus and business loss. Like there is panic everywhere. So what we are doing here, we have a helpline where people can call and get help with their fears, anxieties, basically mental health issues. So we have two layers to it. One is when the callers call, at times, they might not call for only mental health issues, but for grocery supplies or hospitals, etc. So, in that case, the frontline volunteers will give them the required information, And if they call for mild anxiety, fear, uh, so our frontline volunteers, they will counsel them. And for cases with serious anxiety issues, the calls will be forwarded to expert psychologists. So why there are two levels to it? Because there is much shortage of clinical psychologists in India. Currently, we have like 1,000, wherein we need 20,000. Um, just a ratio, just to show the ratio. And this is pre-COVID-19 times. So you can see that the need is much higher now. And so we are basically trying to filter the calls with the help of frontline volunteers to reduce the workload of psychologists. Also, these volunteers are being trained by these expert psychologists on a kind of basic level, and couple of these volunteers are students of psychology, or they have done a short-term course in psychology. And we have also prepared some FAQs and other documents to help them out. And this helpline is up and running. The link I have submitted in the project, so if you want to call the helpline for a demo call, you can just do that. And also we want to run this after this epidemic is over, because the psychological effects, I think they will linger on for decades to come. And after this is over, we want to work with, after this epidemic right now, maybe in 2-3 months it will get over. After that, we want to work with doctors and nurses and police, basically the frontline warriors, because they will really appreciate this help after going through all this mental exhaustion and all. And yeah, and also we can integrate it with other apps here, which can help our callers. So yeah, that's all. And what we are looking for in terms of ask, we need help in spreading the word, and we need to create awareness, because many people are trying to fight this alone, not even knowing that they need help.
Savvy, one
And
minute
if
ago.
they, yeah, hello,
Yeah, 1 minute
You still have
remaining.
them.
yeah,
You can continue for a
I'm
minute.
here. Okay.
Sabi, are you done?
No, it's a little bit is left.
There's
Yes,
just
you
I
can
one
go
minute
believe,
on.
remaining.
yeah. So in terms of ask, we need to help spread the word and spread awareness. And technically, we need help with. Right now, we are facing a problem in redirecting the calls from volunteers to expert psychologists. So if somebody can help with this, it will be great. And of course, funds to run it all like smoothly. And if I have time, can I just add one more thing here?
Sure, very
Can I?
quickly.
Okay, very quickly. So right now this mass exodus is happening, and today only I came up with an idea that these people who are going from these states to Bihar or UP or somewhere, all their children, they are studying in Delhi government schools. So I came up with an idea that maybe we can contact the teachers of these government schools, and all these teachers, they have phone numbers of these people, their parents, right? And these teachers or this database, our volunteers can call, or these teachers can call them up, and they can tell them the effects of this, that they are safer here rather than they are going to their villages, because the village people might not even accept them there, knowing that they are coming from the crowded places. So yeah, that was just one idea which just came to me
Thanks,
today.
Sabi.
And
Yeah,
yeah, that's all.
I think we're out of time, but just last one question.
Hmm.
People, first of all, there was no presentation because her PC broke down. Uh,
Hmm.
Savi, can you talk about how many volunteers do you have very quickly, and how many calls you are getting? And there was one question: if Indians are open to sharing their mental condition.
Yes. So we have 12 volunteers and around 20 psychologists on board. And the written material, maybe then I will send you again later on in the form of a document and with details of all these things. And yes, awareness, we really need to spread awareness because people are trying to fight it on their own. So that is what we want to work upon on a bigger scale. Yeah. Yeah. Hello.
Paris? Paris, are you
Hello.
there? Paris?
Guys.
Yeah, sorry, my internet connection. Well, am I audible, Satish?
Yeah.
Okay.
Yes, you are.
Thank you, Savvy. I will go to Siddharth Jain next. Siddharth, I know your
Okay.
name is coming as Sandeep, but let me make you a presenter. Siddharth, let me know if you're able
I
to
hope you
present.
can hear. Yes.
Yes.
Can you hear me, guys? Yeah.
Yes.
Paris. Yeah. Okay. Hi, everyone. So I'll be taking you guys through the portal that we've been working on. The idea is that we create a delivery platform to enable people, distressed individuals, to connect with volunteers. We call it the COVID SOS or COVID delivery campaign. So what we, I'm not sure if this is hindering any of you guys. Yeah. So basically,
No, we are able to see.
Okay. So when there are organizations and individuals who are trying to help distressed individuals right now, like for example, senior citizens, or let's say pregnant women, or people with poor financial backgrounds, and there are a lot of inefficiencies in the current system because each group is acting individually in their own WhatsApp group or their own, or on their own Facebook network of 100, 200, 500 people, as well as organizations which are going larger are not able to manage the volunteer matching because they have all the address strings and matching ki acha this is Kirti Nagar, okay, this is what area, what, how do you map them, that is slightly tedious. And then post that, what is the progress that can be done on these help requests which are coming in. So we thought that this is a problem that needs to be solved, and some constraints which are always in mind is that there's a lockdown and there are protocols to ensure that coronavirus it does not spread more, and there is a privacy concern that contact details of individuals should not be misused or exposed to unnecessary individuals, as well as everybody starting the chain from scratch and trying to look for volunteers is not something which is recommended because then it defeats the purpose. So what we have tried to build is a geospatial platform. I'll just take you through in the next slide. And here the idea is that it's going to be secure because only people who are moderators or WhatsApp group admins would be given access to the private data or mobile numbers. And then we also try to, not limit ourselves to the volunteers that we can bring by ourselves, but also make it an open pool for letting other organizations intermingle their volunteers here on the same platform through the APIs that we are building here. So initially what we built is a V0, and for this we collaborated with Green Dream Foundation. So this is what it looks like. So here these pink houses are basically senior citizens who have a certain request, and these black marks are volunteers who are willing to help individuals. So these are all real volunteers. We have about 200 plus volunteers on our portal, and it's pan India, if you can see. And we have requests as well. We have about 25-30 requests that have been fulfilled currently. There are 2 live WhatsApp groups that have been operating right now, and the idea is to expand this to multiple organizations and leverage the networks effect here. So in the next version, which is currently under development and should be out tomorrow, this is what it looks like. These numbers are dummy for now, but what it would have is basically an overview of what is the impact that the group or the individuals involved here are able to make, the overview for the general public to see in an anonymized form what is happening in terms of requests and where is there a need for volunteers, as well as an option for people to fill in the forms, become a person with a request or become a volunteer. And or if you are an organization which is, for example, looking to enable a platform like this to help all your moderators and admins work faster and assign people quicker, this is what is a tool that can be used by these people, right? So in terms of now let me get to the numbers wherein how we launched. We launched the V0 on Thursday, and Green Dream Foundation and Ashish Sachdeva, they've been like on ground with their all their social network as well as their ground network. They've been trying to reach out to individuals who can volunteer as well as individuals who need help, and we've been able to, like I said, help about 25 plus people already, and there's been media coverage of the same initiative under the name of COVID delivery across main news channels as well. So what is the expectation on coming onto this Coronathon is two level. First one is the network effect, which we can try to leverage, which is now we are working with a few NGOs, and what if more organizations, more task forces are built onto this platform. So there could be a possibility that task forces, let's say for example, having their own volunteer base, are defined to a specific zone and don't want to make it an open volunteer, don't want to open their volunteer data to other NGOs working on it. So then in that case, we are open to giving out the tool to individuals. Yeah, sure. 1 minute, right? I'll get done with it. Yeah. Yeah. So if organizations like government bodies or somebody is not interested in exploding their data to other volunteers to be helped or other requests to be helped, we can keep it in a private form. But if they are open to it, then it can really leverage the network effect. And the second thing is that currently we are only able to help people who are already privileged or are middle class and above. But if we can get sponsorships for requests, then we'll be able to help the underprivileged class as well. Green Dream also has been doing a phenomenal work in terms of the awareness within Noida as well as the NCR region. And if you look at the contributors, there are a lot of people who are behind this project. I have been working along with Ashish and Chirag as well. So in terms of full time, in terms of investment time, investing time here. Nice. But apart from that, I have data scientists from different teams who are involved here. And these are the contact details. Once the presentation is live, if anyone wants to get in touch with us, please get in touch with us and connect us with organizations. That will be really helpful for us.
Thanks, Siddharth. There's one question I'll repeat from Dharmendra. He's asking what can be done if request from one locality goes high unexpectedly?
So request from one locality goes unexpectedly. What we are currently doing is we are triggering SMS protocols as well as triggers to the organizers that can we check if something's unusual in that, plus SMS to all volunteers that there are need for volunteers in a XYZ area. Can you ask people to register?
Okay. Okay. Thank you. So yeah. So everyone, just a housekeeping announcement. We have 30 minutes left. I request you to stick around for the next 30 minutes. There are teams around contact tracing and trackers and a couple of other things who can also use your help. So please stick around. And again, another announcement is that most likely we'll have the second demo day next Sunday. There are still many projects that are getting built, and these projects will also have substantial updates by next Sunday. So we will be sending an email for next demo day sometime next week. And again, request is to also attend that demo day as well, if you are able to. Cool. So the next team is COVID FYI. I will give it to Simran. I'll make you a presenter. You're next. Simran, please go ahead.
Hello, am I audible?
Yes.
Yes. So good evening, everyone. I am Simran Soni. I represent Project COVID FYI. And just to get started with it, yeah, so
this is fine,
so
Simran,
the whole focus of our the whole focus of our project is to provide right information from the right sources to the right people. So it's kind of a directory of sorts. We have found that the whole problem behind finding right information was that a lot of information is cluttered right now, and it's scattered around a lot of places. Like I would like to give you some examples that if you go to Twitter and you want to see what are the official information as to what are the labs near you, what are some hospitals that you can reach out to, it's very cluttered. Even if you want to just have a list of labs in India, it is spread across 3 different PDFs released by ICMR, Indian Council of Medical Research. And for a normal citizen, it's difficult to understand technical words like VRDL, etc. So we have tried to put all the information at one place in our app called COVID FYI. So I would like to start by introducing the team. We are a team of over 20 plus people, but our core team comprises of our development team, operations team, design team. Manan, Darpan, Dishant, Tanmay, Aaron, Amit, and Avinash. They have all been helping relentlessly to build our app. So the problem that is displayed on the screen is that if you try to Google that, what is the testing laboratory near me, you are led to these websites that are of no use. So this information is not readily available and it's getting lost in the clutter, and when you actually need it, it's not available to you. What kind of information are we talking about? The list of approved testing labs, the list of hospitals, what are the doctors you can call for emergency, what are certain helpline numbers. If you want to reach out to task force teams, national level, state level, district level, or at the departmental level, this information is across all the sources. So these are the problems. And just for a demo, we can show you how our app looks like. This is our landing page. This is the very rough UI that we have created. Once you go to state level resources, you can check for your state. And say if we go to Jammu and Kashmir, we can have a list. We can see there's a list of doctors that has been provided by. And also one thing, that none of the information is without an official source. So whatever information goes in our app has a source link that can be verified. So this information is provided by Department of Information, Public Relations, Jammu and Kashmir. What is it about? These are the doctors that you can reach out to for emergency. So this is how our whole app is currently built. If you want to say search for helpline numbers, it's there. If you want to search for labs, you can find it. So we are trying to transform this front end. It's right now very simplistic, but it serves the purpose. We have national level database. So the significance of this project is that we are trying to get away with all the problems that we face. There is standardization of information. We are getting curated content from right sources. Everything is at one place and it is reaching the right audience. The use cases are several. Government, providers of healthcare, citizens, and even other projects or startups can use our information. Right from national level information to hyper local district level information is present in our database. We are understanding that as the problem will increase, there might be a situation of chaos and people might not know where to go, who to call, which are the labs near me. And this is where we come, that we prevent chaos, we prevent misinformation, and we also reduce the burden of healthcare providers by acting as intermediary. People will not crowd out at labs, etc. And we can help governance and implementation by giving them a ready database. Citizens, as I said, that they can look for all this information. For doctors, they can contact government bodies. For other projects, they can use our APIs to further grow. And these are the use cases for government. Our existing product is a database that has been converted into a front end. What's next for us? We are trying to build an API that can help other projects. We are tagging location to enable hyper-local information for all the information that is near you. We can act as an intermediary to prevent people from crowding at hospitals and labs. People can book an appointment at their home. We are persistently updating the database as and when new circulars are releasing. And we are providing information that is relevant for each stakeholder. So what are the asks from community? We want feedback. We want some server hosting funds. It can be,
Yeah, can you quickly wrap up?
Hello. Yeah, this is the final 2 slides. So we want a point of contact to reach out for any urgent need of funds. skill sharing, we want database team designers. For partnerships, this is where it's important that we want to partner with national government task forces, government IT cells, and other projects and products where you can help us promote our startup. In terms of numbers, we have these are the numbers that we have, that 300 users, 64 ICMR task force contact database. Yeah, so that's about it.
Thank you. Thank you. I will go to the next team, which is Pagar, and Tushar. I will make you presenter. And may I request all the remaining teams to stick on time. We would like to finish on time. Tushar, you can speak. I've unmuted you.
Yes. Am I audible?
Yes.
Yes. Perfect. Hello, everyone. I'm Tushar Khattar. Today, I'm here to present Pagar. Let's take a situation. Let's say there's a couple, husband, wife, and they have children too. Wife works in a fashion retail outlet, and husband works as a delivery person for one of the grocery delivery platform. Because of the COVID-19 outbreak, since a lot of fashion retail outlets are not operating, wife lost her job. Now the pressure is on the husband to take care of the financial situation of the families. In normal times, there are 429 million Indians who live paycheck to paycheck. 57% of those Indians have less than 5,000 in their emergency funds. We can imagine the numbers which are currently in these times. Let's talk about employers a little bit. Because of the COVID-19 outbreak, there is a sudden increase for sudden demand for essential product deliveries. Instacart and Walmart in US are currently hiring around 800,000 employees because of the COVID-19 outbreak. Similar pattern has started to trend in India with an increase in demand for delivery for essential products. The solution that we propose is we enable employees to access a portion of their earned salary up to a certain amount in the middle of month. This is all done without changing employers' cash flow. What's in it for employers? Employers get to attract and retain more employees. They get to contribute towards the COVID-19 war at zero cost. Since their employees are in a lot of mental stress, so they get to help their employees fighting that. For employees, they get access to capital, fast access to capital in need of the hour, and they get to survive these times. So the way it works is an employee raises a request for salary on demand in the middle of month. Pagar pays that amount to the employee. On the payday, Pagar takes that outstanding amount from the employer and the undrawn salary goes to the employee. And whenever an employee raises a request for salary on demand, that transaction is updated in the HRMS of the employer so that it doesn't disturb the dispersal process of the salary for employers. This is the demo of the application. So this way an employee can log into the platform, can raise a request for his or her salary. So this is the past transactions. You can just click on the withdraw and the request is submitted. So what we are looking for is we are looking for 3.5 crore of investment to help out 5 lakh people. This cost will be used to cover up the interest amount of the loan that will be taken from NBFC. We'll need help in connecting with NBFC who can lend us money to disperse the salaries. It'll be great if we can connect with a payment platform for the dispersal of salary, and we'll need help with legal and accounting work. The employers that we're trying to contact are majorly staffing agencies and essential product services. This is the current team. I'm Tushar Khattar, Seema, Sekhar, Miti, Shashwat, Vanya, all of them have contributed in the project. Thank you.
Oh,
Thank you, Tushar. I will go to the next team, Udit. I will make you a presenter. Udit, you should be able to present now. Udit, you're muted. Can you unmute yourself?
Hi guys, my name is Udit Garg. I'm presenting C19. This project is developed in collaboration with University of Oxford Machine Learning Group, University of Maryland, and University of Zurich. So we have Dr. Jack and Dr. Tom from University of Oxford, Dr. Atul from University of Maryland, and Dr. Zhao from Zurich University. As you will see, and you must have noticed, there are a number of contact tracing solutions coming up from both public and private partnerships. Our objective is to enable collaboration between all different stakeholders so that they can use the power of combined data sets. Here's a list of existing contact tracing applications that are out there, both by the state and central government. And there are a number of private initiatives also which use both Bluetooth, geotagging, self-reporting, etc. For any of these contact tracing or self-reporting initiatives to be successful, there are two critical success factors that are required. That is A, very high user adoption, and second, a lead time required for these data collection sources to build an empirical data of at least 5 to 7 days. Considering the size of India and the problem is catered to the masses, there are a number of challenges, including only 27% of India has smartphone access. Therefore, a number of apps cannot be used. Segregated data collection, privacy concerns of people due to state surveillance, etc. All of these lead to long lead times. Therefore, the only viable solution that we can see is A, to enable alternate data collection sources, and also to enable them in a manner that they can interact with each other without facing the issues of privacy of A, the patients, and B, the users. Number of stakeholders could be mobile applications, which are already collecting user data, self-reporting applications, contact tracing applications, etc. The solution that we have come up with is a multi-party or double-blind computation communication protocol. What it simply does is it allows two parties with different data sets to interact with each other, run an analysis without actually sharing the underlying data with each other. I'll quickly walk you through a worked example. Let's say the government wants to identify all the people who have crossed paths with a patient, Mr. X of COVID-19, in the past 14 days. The government has limited location data of that patient. Whereas there are a number of applications, let's say hypothetically, PhonePe is collecting user location data for the purpose of its own application. And they have access to past 14 days of data, whereas government will take next 7 to 10 days a lead time to generate that data. So how MPC would work is a key generation unit party, a third trusted party, can issue correlated encryption keys to both the parties without actually seeing the underlying data. Both the parties can encrypt their data sets. Beyond this point, no third party is required in the process. Now, the key point is these encryption keys are structured in such a manner they're correlated, thereby when the two data sets interact with each other, the corresponding encryption pads are cancelled out, thereby leaving you with just the final output of results. The results will be a list of mobile numbers for, say, in this example, who were in contact with Mr. X in the past 14 days. So thereby allowing government and private company both to leverage available data sources to do a simple task such as contact tracing in a short period of time, without the private company actually sharing the underlying data set of its users, or the government actually having to disclose the information of any COVID-19 patient. Both are very serious privacy concerns in general use case. So this is exactly how MPC would work. There could be another question around how would the output actually ensure privacy. So what the algorithm does is just basically gives the binary result, that is whether the person was in the location or not, thereby avoiding, avoiding any triangulation possible using distances that a number of other algorithms do. There are a number of MPC solutions available in the market. However, they're very computation intensive, therefore require a lot of processing power and time. What the research group here has been able to do is shorten that and make it practicable and specific for contact tracing, therefore easily deployable. I'll give you a quick update on the status. We have an MVP running, which is highly scalable. A detailed white paper in collaboration with research group University Oxford, Maryland will be public in next few days. What we want from government and India Inc. is to adopt the solution, consider this as a possible solution to make their useful data sets available for each other. And secondly, if this goes to scale, help us with implementing it by giving us support of infrastructure. We do not plan to charge or have no intentions of charging for this communication protocol from any party, as this is a purely humanitarian cause. That's it from my side. Thanks.
Thanks, Udit. I have one question from Akanksha Singh, who's asking, is it limited to two databases or can several databases interact with each other?
Several databases can interact with each other. Multi-party computation is a very known protocol. However, the only challenge is it is very slow and compute intensive. This approach makes it faster and practicable and deployable instantly.
Okay, thank you. Thanks, Udit. Manish Paul, you are next.
So sorry,
Yeah.
one point I want to make. We are open to sharing any further detailed information, specifications, or to satisfy any concerns that any party may have in order to adopt the solution. Thank you.
Fantastic. Thank you. Manish Paul, you are next. I've made you a presenter.
Yeah. Hi, everyone. So I'll start now. My project is called Safe Zone, and I'll just start the presentation. Yeah, I hope you can see. The developers are Lok Bharti, Ashish Sharma, and me, Manish Paul. I'll just quickly show what the current situation is. So patients and suspects need to be quarantined, and there's no way to enforce quarantine right now. So the only thing that we're currently doing in India, at least, is manual verification, where health supervisors are going to a person's house and verifying whether the person is quarantining himself and is in isolation. The government relies on individuals to self-report, especially at airports. So once you are out of the airport, nobody tracks you, and even at the airport, you just have manual checks, and there's no way to follow up. And we've seen a lot of cases in India where people have just come out of the airport and they've started roaming around freely. So the current solution that the government has is stamping hands, arms. They do a manual follow-up. You are forced to self-report your travel history, and you can just sneak into an apartment and nobody will ever know. There are cases where people have played holy despite having some travel history. So there are posters outside quarantined homes, and these are some of the images that you might have seen coming out of the news recently. So what is our safe zone about? So suppose we have two people, one is a suspect and one is a traveler. They both are made to install the application on their phone, and while installing, it's a simple OTP based registration where you have to mention your isolation location. So suppose you're at the airport, you will have to just mention that, okay, I'll be quarantining myself at the home, or maybe your parents' house, and you upload a selfie along with it. So I'll explain what the reason for the selfie is. And for the next 14 days, uh, uh, this Safe Zone app will keep sending you notifications, and these will be at very random times. It could be 2:24 p.m., it could be 9:34 a.m. So at every notification, you need to upload your current location, that means where you're present, along with a selfie. Okay. What happens next? And if people try to upload someone else's photo, so I just try to fake a photo, I get a notification, I'm outside, I give my phone to my sister or my brother and I say, just upload your photo. That will not work because we have facial recognition there. And suppose you're outside your house, beyond a certain radius, beyond a certain boundary. I think somebody else also remote something similar. So as soon as you're somewhere outside your location, we will detect it, and there is a location check. So it enforces you to stay at home, and there's no way to there's no way to fool the system currently right now. Okay. And what else can you do with the application? So suppose after the 7th day you start developing symptoms. The government has no way to track right now that a person in quarantine who came from a foreign travel or was in touch with a suspect has developed symptoms. So you can report your symptoms, right? And what impact does it make to the government? So if the government is there, they get a notification saying, hey, there is some live feed and somebody is unreachable. So it seems either they've switched off their phone, they're out of their location, they've probably run away, or maybe they're just not feeling well and they are unable to respond to notifications. And they can also see, oh, symptoms have deteriorated for somebody. And that's not it. They track it on the map where exactly they're staying, and they can produce heat maps of every location where they see the maximum number of cases. This will help them plan and prepare for hospital requirements in the nearby areas. So this is what the government can do. They have a real-time dashboard of everything. So what are our asks right now? We are looking for support from airport authorities for adoption at airports, especially because a lot of countries are because a lot of countries have placed travel restrictions and they're asking you to self quarantine. So a better way would be to have this application and do it at the airports. And we have health
One
supervisors.
minute ago.
Yeah, there are health supervisors, police department who are trying to enforce this, and anyone who can stop people from running. So we want support from everybody. On the cost side, we have some expensive technology running around. So we need help for cloud infrastructure, Google Maps, and facial recognition. So these are our three major cost areas. If somebody can help. And on the developer side, we are still running short of developers. If you need Android, iOS, and anyone who knows Google Cloud and Firebase, plus user experience. And some of the concerns, privacy. So we are not storing the images. Of course, when this is adopted, it is stored by the government. We are not storing any data. It has to be encrypted and following all the security protocols of the government. And more importantly, enforcement exists even now, but it's manual. So why not just make it a little more advanced? The current status is we are in beta and we are hopeful to release it in the next 2 days. And in times of crisis, we do not
Manish.
monetize it. Yeah, and it's free if it helps the society, except the server costs, of course. Yeah, you can see the demo on YouTube. Sorry, I can't show that. I'll just share the link. Thank you.
Thanks, Manish. One question I think Puneet asked, can the patient info be on top of Aadhaar? And Shiva asked, can something like a fingerprint recognition work, if not facial recognition?
So we can incorporate that, but our main thing was facial recognition now, but that's a good suggestion as well. Secondly, sorry, so the second question was related to Aadhaar, but that will not work out for foreign travelers. And secondly, getting Aadhaar data in a very short time is pretty difficult as far as I know. And this being a private, developed by somebody non-government, it will be quite difficult to get that, right? But that's
Okay.
a good one. Thank you.
Thank you. I will move to the next team, which is Vishal, FF Protect. Vishal, you are the presenter. And by the way, this is the third last team, so people please stick around. We're still hoping, I think we will take 15 more minutes, but after 3 teams, we'll be done. Vishal,
I hope
please
you can see your screen.
No, not yet.
One second. You're able to
Vishal, if you're taking,
see my screen?
No. If you're taking time, we will come back to you. I will move to the next team. If you have to figure out logistics.
Yeah, please go ahead. I'll just know the next.
Yeah, maybe try restarting GoToWebinar. Niket, you're next. I'm making the presenter. Niket, over to you.
Okay, hi
You can
Paras.
unmute
Is my
yourself.
screen visible?
Hi. Yes.
Just wait. So, hello, I'm Niket Kamath, an intern at Juno, and the rest of the team, Shrey, Rishikesh, Sanket, Salil, and Nishad, are engineering students from Goa. We have built a dashboard tracker and are currently working on adding more features to it. And we are also building a community on Twitter and Telegram to combat fake news. So things are kind of getting out of our hands. One person spreads it to 3, which is approximately 60,000 people in 10 days. if tested properly. By the time the vaccines or health kits arrive, it will be too late. So the only way we can save lives is by curbing the spread of COVID-19. We have categorized the situation in 3 stages. As per our market insight, the need of the hour is to build something for the pre-quarantine stage. Government is handling the post-quarantine and the medtech professionals are handling the quarantine stages very well. But we are running out of time and things might slip out of our hands soon. So how do we stop the panic? How do we create awareness? How do we save lives? By empowering each individual to take informed decisions. So we have built a corona tracker. But hey, why should I use this dashboard? So apart from all the verified and live stats, we are also showing the infected case position on a city to village level basis. So not just state, and also which enables any user to check their location of how far the confirmed case is from their position. We have also put in health centers on the same tracker with all their details and how to get to them. Also, we are also displaying some other features as well, and you can even shift to the world data with just one toggle. The platform works seamlessly on any mobile device too. So coming back to the presentation, we have seen some unexpected growth with just 10K people a couple of days ago to having 100K yesterday. And we would even be happy to open up our platform for other projects to get their early traction and an audience to blitzscale their project. We want to help others with our distribution. We've come a long way since we started in Feb without having any audience to having been featured by Niti Aayog, Indian Express, and various government newspapers. Also, we have a following of 5,000 people on Twitter where we push daily live updates. But this is not enough. Because we have a good distribution, we would love to be the hub of everything related to COVID-19 by collaborating with other projects. We have built a tracker and combated fake news. And now we want to build a hyperlocal platform to help the government. Something like this prototype that we have built for Mumbai and BMC. So here on the user side, I can see which are the infected areas, the high alert areas, where the cases have been. Also the location of hospitals, health centers, stadiums, which can be later used as isolation or quarantine centers. And also on the government side, they get all the data of the symptoms and the people who are showing symptoms. So at the moment, the data of infected people is more important, but we feel in 10 to 15 days, the data of which people are suspected will be more important. So we are working on collecting the suspected patients' data as well, which will be open sourcing later to something like Telemed's team of Startup versus India, where they can do the testing. We are also working on notifying the primary, secondary, and tertiary infected cases depending upon their location in the last 14 days and tell them if they need to quarantine themselves or get themselves tested. There are some privacy issues, but because everyone has a phone with GPS, we can target a much wider range of audience in this way. And we are really open to blitzscaling other projects as well. So any assistance from investor, Google Pay, Phone Pay to get any funds or donations will be used to build better platform by putting more paid features and even getting better hosting and servers. This will even help us in our distribution. It will also allow us to explore more ideas which we haven't even thought of because of financial constraints. We are in touch with people at Telemat's team and even the endcoronavirus.org. So we assure you that all the funds will be made the best use of, and all the donations we have received so far, we have used to help people in Goa in the time of lockdown. Most importantly, we want to get in contact with people in the government who can help us build these new features faster because we really don't have any time to spare. Thank you. That's all from my side.
Nikhil, thank you. I have one question from Shiva. He's asking what privacy safety features are thought of to protect identity of suspected patients. And Alok Mittal is asking how is information being procured?
So about the first question,
we are still working on how to do that. We might even end up collaborating with some people who are doing contract tracing. But what we are thinking of right now is partnering with someone like some people from Google, or even getting the acceptance from the government to build something like that, where we can use this data of the last 14 days and help people curb this.
And
Paras, can
how
you
is the
repeat the
information being
second question
procured?
again?
Yeah, Alok Mittal asked, how is information being procured?
So we are still working on that. Like, we aren't exactly like sure. We are still working out on different flows of how to go about that. But yeah, we'll be putting that out in like the next 2 days. And we'll be having like a proper structure of that too.
Okay. Thanks, Niket. And everyone, in the interest of time, we will have Vijay's presentation next demo day. So at the end, we will just last project, Ajay Hegde. I'm making you the presenter. And after this, we'll wrap up the session with closing thoughts. Ajay, you should have the presentation access. You can unmute yourself. Ajay, you are on mute. Can you unmute? Yeah.
Can you guys hear me?
Yes.
Yeah. So I'm Ajay. So I'm going to be showing you our project, which is trackcovid19.org, which is a crowdsourced community-based illness tracker. So let me quickly introduce the team. So I am Ajay Hegde. I'm a neurosurgeon by profession. I've been supported by Abhilash and Vinayak, who have listened to all my tantrums in developing this project. And I've been advised by Professor Masti, who's a professor of public health and is actively involved in the Bangalore contact tracing and quarantine team. So first, let me just quickly run you as to why we need a community-based tracker. So all of you must be very familiar with this chart by now. And you must also be familiar with these graphics which show flatten the curve. So from a public health point of view, these are not of much value. They look beautiful. They tell us, okay, there are so many cases in this area, and that's about it. So this made me think and go back to my medical textbooks, where in 1854, that is 166 years back, this man, John Snow, he was a physician in London. He mapped cholera in London and found that there was one water tap which was contaminating everybody in the locality. And then he mapped the deaths to the level of each house and how many deaths had occurred to this in that house. So coming back to this, in 1854, if we had so much of data, today in 2020, we have data maximum up to a district level, I would say, nothing more. So that is why we sat ahead and designed this project, which is primarily to track asymptomatic carriers and symptomatic carriers, as it is impossible to test everyone in the community. And the policy of lockdown, track, trace, and community surveillance. So we intend to play a part in the community surveillance part. So our solution is a community-based crowdsourced illness tracker, which crowdsources symptoms like cough, fever, or shortness of breath. And it has the granularity of going down to a zip code or a pin code. So there's a lot of evidence here I can share with whoever is interested. I will not bug you with that. So what we did is we took a world map and then we layered all this data. We took the symptomatic people, healthy people, and then we took some confirmed positive and any other data set. And the source of this data was the healthy and symptomatic people came from crowdsourced data. The other two data sets are primarily by going through media articles and government databases to see if we can find specific locations of these people who are infected. So we've not been able to get much information on the last two layers because we don't have ideal databases to the level of a zip code. And as I mentioned again, all this is done to the level of a zip code. And this is a brief outlook of the technology. So this is our product. This is the product we've had for a week now, collected data from around Bangalore. So you see the green circles are the healthy people. The red ones are the symptomatic people. These are not people who have COVID-19, but just people who are symptomatic with cough. And I mean, it doesn't look as good as the map John Snow did in 1854, but it's probably better than the others we thought. And let me come to the impact. The impact is primarily a public health impact. So I've demonstrated two representative samples. So if you see the green circle is big, then it means you're in a healthy community. So the public health individual of that area can say, okay, let's give this community some time, let's isolate it, or probably you could release them from a lockdown quicker. But the same community, if it has a big red circle, then that's really a problem. So then all the resources have to be directed to that community to test, test, and test. So from a public health perspective, it gives you this information. It helps you identify hotspots, direct surveillance to the right areas, phased opening of communities from a lockdown, and it allows you to test the right cohort. And for the consumer,
Ajay, 1 minute to go.
it tells you what's happening in the locality. And I'm going to quickly tell you why this will work at this point of time. So between stage 2 and 3, I would want to highlight to you guys that community surveillance plays a very important role. And the feasibility, there's high engagement in such technologies during pandemics, increased social media network usage, and a community that wants to help. So I leave you to just scan this QR code or visit our website, Track COVID, which is live. And you guys can have a look at it yourself, where I also run you through it very quickly. So I'll ask you what I need right now. So Dr. Jacob and Mr. Patil, I need your support for national implementation, promotion, and providing postal codes of confirmed positive individuals. So we're not asking for any patient identifiable information. We're just asking for postal codes, not again cities. And the tech community, Mr. Chinnaswamy, we want you to help us promote and incentivize usage with GPay and cloud credit from Google to scale operations. And Mr. Mittal and Mr. Raghava, we need some money to scale operations to employ a full-time support if we have to track the whole of India. And probably this could develop into a national infectious disease tracker. And we need some Facebook credits. And coming to the strengths of this, working on further features like
Ajay,
cloud. Yeah. So
could you
I'm just
quickly
going
wrap
to
up?
quickly run you through the
Ajay, yeah.
platform. Yeah, this is the platform we have. So this is yes or no, and then it gives you live data. You go down to the level, gives you granularity up to a zip code. You can see any zip code you want, and I'll let you play. And these are the live stats as to how many people have been registered on our website. And you guys can go and use this and track yourself and get to know what's happening in your community. Yeah, hello.
Thanks, Ajay. I have I'll take two questions.
Yeah, sure.
Tracy is asking, how is community data updated? Are
So
users supposed to update their symptoms regularly?
So that's the thing. So we don't have a login screen yet, but we have the facility for that. And we are in the process of developing a login, which is just a 4-digit code which comes up when you submit the data along with your zip code. And when you enter that, you go to your own data and you can edit it. So that's in progress. We don't have it yet. We don't want to use emails, phone numbers, nothing. We don't want anything to track back to the user. We just want the zip code and a 4-digit alphanumeric code, and you'll be there to edit your data.
Okay. And Biju Jacob is asking, can you integrate it with IDSP, which is National Disease Surveillance Program?
I mean, if definitely it should be the outlook of this project is beyond the coronavirus epidemic. I mean, this has to be implemented on a national scale, considering India is quite susceptible to infectious diseases. I mean, we need technology like this to track infectious diseases down.
Oh, great. So thank you. I will wrap up this presentation here. And so before we end, I would love to have a few of the attendees talk who've been very helpful in their support. So there are far too many who I can ask for. So I will just have closing remarks by Alok and Biju. So Alok, I would put you on unmute. If you could take 30 seconds to just wrap up with your thoughts, that would be fantastic.
Yeah, no, some great ideas in there. So thank you for having me over here. I think one of the things to think about would be the pace of adoption of some of these solutions.
Alok, you're not audible.
Hello, can you hear me?
Yes.
Hello. Yeah.
Sorry, go
I
ahead.
was saying one of the things to think about might be the pace of adoption for some of these ideas, because it seems like we've got only 4 to 6 weeks time to start to get to high levels of adoption. So I personally like some of the things that do not have either high adoption barriers or a need for a priori critical mass for the service to be useful. But I think within the teams that are working, one of the ideas to accelerate the pace of adoption, especially in consumer apps, could also be to think about a COVID super app, where if you guys are offering complementary functionality, then does the value prop improve if you bundle your solutions into one app, and so the user gets multiple features in that app rather than having to scout for multiple apps. But so that was one thought on the GTM side, but clearly there were 3 or 4 ideas that don't fall in this category. They might have their own favorable GTM curve. Thanks.
Sure. Thanks, Alok. Biju, I'm unmuting you. Love to have some closing thoughts.
Yeah, thank you so much. Great efforts, organizers, within a short time. Wonderful ideas. One quick thing which I was thinking is there's some few of the startups with the summary of their needs. We would be happy to post in the global COVID innovation index, which we have created with links. So other companies and also the support structure, especially the grants and things which is listed in our platform, can kind of matched with the needs of startups coming here, and we could just help them to accelerate the process. So it's great. Would like to take it offline.
Thank you. And Shiva, I would love to have closing thoughts from you as well. I've just unmuted you.
Thank you, Paras. It was really great to see so many ideas. And in fact, I was suggesting earlier to Arun that some of these ideas, similar to what the previous a super app or clubbing joining hands, the ideas are similar and to increase pace of adoption. The other thing is that anything that involves public data or involves location data, we have to be really cognizant about privacy, because rumors can spread and the person's safety could be at risk. Outside of that, there are quite a bit of these ideas that are with little bit of refinement, they can cross the privacy, both the privacy barrier and the adoption barrier. So I look forward to connecting with some of this later offline and carrying for more discussions.
Thanks, Shiva. So in closing, let me thank all the panelists and all the attendees who've come to really spend their 2 hours and look at the projects. Just as a reiteration, we will have more teams develop in this following week as well, and we'll send like a demo day link again, most likely, which will be held for next Sunday. I thank all the teams who've come together without any incentive, without having to know each other, and build these projects. And special mention for all the developers who've been working behind the scenes to get these projects out. And lastly, I want to thank the organizing team that has been working really hard. So allow me to acknowledge members of the organizing team: Satish, Sparsh, Arun Patre, Vivek, Akash, Shruti, Cynthia, Kriti, Ankijan, and many others. So so I so I just got a notification. Pranay, also one of the attendees, wants to speak. So I will unmute Pranay and then we'll close the session. Pranay, I have unmuted you. Love to have some closing remarks.
Yes. Thank you so much. First of all, big thanks to the organizers and presenters for putting this through. It is overwhelming to see the ecosystem coming together for the overall preparedness and mitigation of COVID-19. And as someone who is working with the government, I think it's a great opportunity to see
the private sector coming up and augmenting the efforts that the government is putting in. I would just want to leave the meeting with two thoughts. The first thought is that in the presentations today, there have been very novel ideas that have come together, but eventually we'll have to see a way to kind of collaborate amongst the ideas as well, because I saw that a lot of ideas were complementary to each other. So when we are focusing at a pandemic at large, I think there's a bigger avenue for the ideas to as well break the silos and come together in order to create a very coherent solution for developing ideas towards the preparedness and mitigation. And the second thing, again, by the virtue of wearing a hat of a government official, what I would strongly recommend the presenters to think about is the scalability and the sustainability aspect of it, because we are talking about numbers that are unprecedented. We are talking about a situation that is unprecedented. So it is extremely important that you have that checklist in place, which ensures the sustainability and scalability of your idea, so that necessary connections and necessary ecosystem support can be leveraged by partnering with the government. These are the 2 cents from my side. Thank you.
Thanks, Pranay, and thanks everyone again for your time. We will send a recording of this demo session in the email as well. And again, we will also, throughout the next week, Monday, Tuesday, we'll connect everyone who's posted comments or requests for help or feedback with the teams. And we will have a follow-up demo next Sunday as well. Until we are able to have COVID in control, I think it's important that the tech teams continue building whatever they can. But most importantly, of course, we can never replace the work of government, doctors, medical workers, and healthcare workers. But whatever the tech community can do, we are just trying to do our best. So thank you, everyone. Bye-bye.
Hello, guys. Just a quick comment. I wanted to take this opportunity to also make show a thanks to Paras. This idea of Coronathon was his. What started off as a tweet has become a community of nearly 2,000 people, and we have around 40 plus projects at this point. And it's all thanks to Paras's leadership and the direction he's shown and the drive he's put in every single day since last weekend. So thanks a lot, Paras. We are very honored to be working with you as well. Thank you so
Thanks,
much.
Satish. It's truly a community effort. So I was the one to kickstart it, but truly it's the community effort and volunteer driven. So thank you. Look forward to next demo next Sunday. Bye bye. Have a safe week ahead.